I am Dr. Raman Boddula, a senior consultant in endocrinology at Yashoda Hospitals, Secunderabad. Today I am going to talk about obesity and its management. So obesity is increasing in pandemic proportions across the world. It is mainly because of the changing in the lifestyle, that is due to increased consumption of calorie-rich food and reduced physical activity. These two factors leading to accumulation of calories and fat in the body, leading to obesity. So obesity can give rise to multiple metabolic and health issues if it is not controlled. So mainly it leads to the increased incidence of diabetes, hypertension, high cholesterol problems, all these together leading to increased incidence of cardiovascular problems and the kidney problems. And also it leads to the increased incidence of degenerative joint disease, like mainly knee joint arthritis requiring knee joint replacements. So any major health issue if we take today into current scenario, the major root cause can be traced to obesity. It is classified based on a simple calculation called body mass index, BMI. So we can calculate this by using two parameters, that is weight in kg and height in meter square. So you have the formula weight in kg by height in meter square, and the square root of this product will give you the value of the BMI. So according to the number we can classify. In general it is classified as less than 25 BMI is considered as normal, 25 to 30 overweight, 30 to 35 class 1 obesity, 35 to 40 class 2 obesity, and more than 40 class 3 obesity, or otherwise called morbid obesity. So if you talk about Indians, obesity in Indians, it is slightly different compared to Western counterparts because there is a change in the body composition in Asians and Indians compared to Western people. So we Indians, we tend to accumulate more fat in the abdomen. When you put on weight, more of fat accumulates in the abdominal region, causing central obesity. So the central obesity is more dangerous compared to the generalized obesity because this will increase the insulin resistance of the body, which will in turn lead to the increased diabetes, hypertension, high cholesterol, together leading to increased cardiovascular problems. So central obesity is much more dangerous than generalized obesity. So given the important health consequences due to obesity, so how to manage, how to treat obesity? So we have the three components in the management of obesity, that is the diet, the exercise, and the medication. And lastly, the surgical option also is there, that is bariatric surgery. So in the diet, how do you manage? So a balanced diet which comprises appropriate amounts of the carbohydrate, the proteins and fats is recommended. Mainly the restriction of fat is recommended because fat is rich in more calories. So in general, vegetarian diet gives you a balanced diet with less of fat. Among the non-vegetarians who consume non-vegetarian, it is recommended to reduce the consumption of the red meat, and chicken and fish can be consumed less often. So whatever dish you prepare, you have to prepare with less oil, as less oil as possible. And it is generally recommended that the average consumption of the oil per month per a healthy adult is 0.5 liter person per month. For example, if 4 people are there in the family, they are supposed to consume 2 liters of oil in a month for all purposes. This is the average recommendation to remember as far as the oil consumption is concerned. So the diet control followed by the exercise. So what do we have evidence with regards to exercise? So it is proved that in studies, if we do moderate intensity exercise 30 minutes a day, 5 days a week, that is 150 minutes physical activity per week, which is moderate intensity exercise, it can give rise to a modest weight loss, 5 to 10% body weight, and this will in turn lead to the modification of the multiple metabolic abnormalities, mainly the diabetes, the hypertension and cholesterol can be reduced, and the comorbid conditions can be modified accordingly. So exercise, regular exercise together with diet. Then the next step is the medication. Thank you.
Like, comment and subscribe for more health updates.